Hi, myself Mr. Nilanjan Ghosh. Actually, I am a M.Pharm pharmacology student in West Bengal University of Technology. Basically, I am doing a project work on cardiovascular disease. Specifically, it's two types of disease. One is atherosclerosis and another one is myocardial infarction, which is quite related to each other. Actually, what happened in case of atherosclerosis, there is a plaque formation that takes place inside the coronary circulation of heart. When this plaque formation takes place, it reduces the blood supply due to formation of blockage. When this blood supply reduces, there may be a chances of ischemia or hypoxia. When this ischemia takes place, there is chances of necrosis on myocardial muscle, which is called myocardial infarction, or it may call MI. In my project, I am concentrating both these two diseases, atherosclerosis and also the myocardial infarction. In case of atherosclerosis, what I am doing, I am selecting a rat model system. I am giving a very cholesterol-rich diet along with cholic acid to produce atherosclerosis on rat. I am using lard oil, peanut oil, propylthiouracil, cholic acid, sodium chloride, carbohydrate, and some protein molecule mixture. I'm preparing a food with all these chemicals, and I'm giving to a group of rats to produce this atherosclerosis. It means a model system actually. When this atherosclerosis will produce, I'll use my drug to evaluate the pharmacological activity of my drug. So, before going to the pharmacological aspect of my drug, I have to say something about the drug molecule, which I had been synthesized already. Basically, it's a bioflavonoids and it's a metal complex. It's a complex compound. Due to some privacy policy, I can't say the exact name of bioflavonoids, but it's a bioflavonoids and metal complex. You can find it in my publication. That's the main reason I'm not saying all these things in this video. You can find it. But after the synthesis of my compound, I had done some characterization studies like XRD, DSC, NMR, MAS, FTIR, and UV. After this study, I got a very good crystalline structure of my compound. Basically, it's a bioflavonoid metal chelate complex. After this, before starting this pharmacological studies or pharmacological evaluation, I had the toxicity study in mice to calculate the LD50 and ED50. I mean to say the dose calculation. And I got a safety dose and also a toxic dose. And in case of the pharmacological evaluation, after giving all these drugs, all these food particles, all this food substance to those rats, I'm giving my drugs to see how much it is reducing the cholesterol level in the body, along with how much is reducing the plaque, formed plaque on coronary circulation. Basically, I have to see the aorta while doing some histopathological studies. And in case of biochemical parameters, I have to do the lipid profile like total cholesterol level, LDL level, HDL level, VLDL level, all these things, along with triglycerides. And after this, I have to do this experiment. I have to do the evaluation of my drug on myocardial infarction. To do these things, I have to do a rat model system. It means ischemic reperfusion technique is one of the best techniques for studying myocardial infarction. So in that case, I have to do thoracotomy. So what is thoracotomy? I have to open the rat thoracic cage by using scissor or some surgical instruments. And after this, I have to take the rat heart and I have to occlude the left anterior descending artery of rat heart. And after occlusion, I have to keep it for 90 minutes. During this time, I have to give my drug in solution form with syringe pump and I have to see how it is preventing the necrosis on myocardial muscle. This is the main aim of my project in case of in vivo study. And in case of in vitro study, I have to do basically in vitro studies. So now I didn't do all this atherosclerosis study almost over, but myocardial infarction means ischemic reperfusion technique is still not over. I am doing all these things. You will find it day by day in my updates and all this information. I'm providing you in videos in case of cell line study, what I'm saying just now, I have to take rat cardiomyoblast tissue. It means H9C2 cell line is one of the best cell line for studying myocardial infarction, or in case of heart disease. So what I have to do, I have to do MTT assay, it means the cell viability assay, which is very common for all types of cell lines. And after this, I have to do superoxide dismutase activity. In third, I have to do scratch wound sealing assay, annexin V assay, Western blotting technique, and also PCR. In case of Western blotting technique, I want to see which protein is going to express in case of atherosclerosis and also in case of myocardial infarction. And after getting this, I'll see the band density of the protein in case of Western blot shift. And when I got this band, when I identify that very protein which is responsible for produce atherosclerosis, I'll go for PCR or qPCR or RT-PCR study to identify the specific gene that's responsible to produce this disease. But my aim is like that. I have to reduce the gene expression by using my drugs. I'll see which gene is expressing and how my drug is acting on that very specific gene. That's the main thing which I want to do. That's the main aim. So this is my project work, entire project work in brief. I'm going to explain you all these things day by day in my updates. You can find all this information, all these videos in my site, in my website. So kindly cooperate with me. Thank you.